This post is all about tick prevention. Learning about the ticks that inhabit your area and how to identify them can help to protect you and your pets from exposure to tick-borne disease. What are ticks? Ticks are disease-carrying parasitic arthropods that feed on the blood of their hosts and can be dangerous to our pets. Identification. A tick is very small, typically dark brown or black. The actual appearance of a tick depends on its life stage. Larvae have 6 legs, while nymphs and adults have 8 legs. Some species are pin-headed size in juvenile stage, but it is a little more obvious in the adult phase after feeding. If you find a tick moving on your pet, the tick has not fed. Species. Canada is home to 4 main types of ticks: deer ticks, brown dog ticks, American dog ticks, and Rocky Mountain wood ticks. These common tick species usually reside in wooded areas, shrubs, or tall grass, where they wait for prospective hosts. Infection can occur when a dog is bitten by an infected tick. Life stages. Most species of ticks have 4 life stages: eggs, larvae, nymphs, and adults. To mature, they have to feast on blood during each stage. The lifespan of a tick depends on its species, ranging from several months to 2 years. Where are ticks found? Ticks are found in grassy, wooded, and sandy areas. Heavily forested areas and grasslands may have the densest population of ticks, so activities like hiking and camping will require extra precautions to safeguard your dog from these pests. That being said, ticks can survive in various environments, and that tall grass at your neighborhood park could also be hosting some unwanted bloodsuckers. Attractants. Ticks are attracted to motion and warmth, causing them to seek out a comfortable home in warm-bodied mammals, including people and dogs. They find their way onto an animal by climbing to the top of a leaf, blade of grass, or short trees. Here they wait until their sensors detect an approaching animal on which to crawl or drop. Lyme disease. Lyme disease is an infectious disease caused by bacteria called Borrelia. Lyme disease is transmitted to dogs through the bite of a tick. High-risk areas for ticks in BC are highlighted on this map. Signs and symptoms. If you start seeing the following symptoms, your dog may have a tick somewhere on its body: licking and chewing, red inflamed skin, scabs, anemia, head shaking, tick paralysis, Lyme disease, depression, loss of appetite, fever, swollen lymph nodes, and renal failure. Inspect your pet. Check your dog immediately after it has been in a tick-infected area. Regular grooming routines can help you catch ticks and tick bites before they worsen. Tick removal. Removing the tick quickly is important since the disease does not appear to be transmitted until the tick has fed for approximately 12 hours. Using a pair of tweezers or a tick removal hook is the most effective way to remove a tick. Use caution to avoid tearing the tick and spreading possible infections. Spread your dog's fur, then grasp the tick as close to the skin as possible. Very gently pull straight upward in a slow, steady motion. After you've removed the tick, make sure to wash your hands thoroughly, clean the bite site with rubbing alcohol, and rinse the tweezers or tool with disinfectant. Get your tick tested. Testing the tick is important to identify its species and diseases it may be carrying. It will also help researchers learn more about tick habitats and patterns. Prevention. Dealing with your dog's tick problem quickly and using the right preventative measures will help keep them safe. Keeping animals from thick underbrush reduces their exposure to ticks. Dogs should be kept on trails when walking near wooded or tall grassed areas. Some products are available over the counter, where others are only available through your veterinarian. Consult with your vet to discuss the best options for your pet. Resources include etick.ca, a public platform for image-based identification and population monitoring of ticks in Canada.